Hello, I'm Joel Barthelemy. Healthcare is changing. Have you noticed? Let's look at what is happening with physicians. An increasing number of doctors have given up private practice and are now employed by accountable care organizations belonging to large healthcare enterprises. I don't want to bore you, but this blog does have a lot of statistics in it, so be prepared. 24% of the 24,000 physicians surveyed for the Medscape Physician Compensation Report for 2014 said they were participating in ACOs, or accountable care organizations, versus a fee-for-service private practice. Another 10% were not yet in one, but planned to join yet this year. Self-employed physicians, whether in specialized or primary care, still earn more than those who are in the new ACOs. Here's a look at some of the annual compensation from the report. Orthopedic surgeons make the most, on average $411,000 a year. Cardiologists earn $351,000. Psychiatrists and primary care physicians make less than $200,000 a year. Sounds like a lot, and it is, but doctors usually have to pay off hundreds of thousands of dollars they borrowed to get through medical school. And often what they make has to cover staff salaries, business expenses, and malpractice insurance premiums, which continue to go up. In some locations, it's difficult to find an obstetrician because of those high premiums. Only 50% of physicians believe they are fairly compensated for their work. Surprisingly, only 37% of plastic surgeons feel they are fairly compensated. And yet, they were 7th among the top earners at $321,000 annually. So, how does this impact our seniors and Medicaid populations? Well, 57% of self-employed physicians and 69% of the ACO-employed doctors said they will continue to take new and current Medicare and Medicaid patients. Due to the concern about compensation, 15% of the physicians in private practice said they would no longer accept any new Medicare or Medicaid patients, and 3% said they plan to actually stop taking current Medicare, Medicaid patients. That's nearly 1 in 5 publicly insured patients. Enough of the dollars. Now let's talk about the patient involvement. More than a third of the physicians, 36%, said they worked 46 to 50 hours a week or longer with patients, and that does not include the additional time they spent on paperwork. Nearly half of the doctors surveyed said they see more than 76 patients per week, but 13% log more than 125 patient visits each week. On average, that's 25 patients a day. About 50% of the primary care doctors report they spend between 17 and 25 minutes or more with each of their patients. Asked what they found most rewarding, a third said being very good at finding answers and diagnosing problems. Another third said it was gratitude and their relationship with the patient. Only 10% said making good money at a job that they liked. Here's another interesting fact. 27% of the physicians surveyed by Medscape said they would participate in health insurance exchanges, but 53% indicated they had not yet decided. So a lot remains unsettled about healthcare, even among our nation's physicians. I know this was a lot of data to digest, but like all of my blogs, you will find a transcript below the video window. I'm Joel Barthelemy. Have a comment about this topic? My email is joelsblog, that's JOELSBLOG, at globalmed.com. You'll also find it on this page. Thank you.